Hello everyone, I am urologist Omar Makaya. The subject we will talk about today is the complaint of urine dripping after urination. It is a common complaint. It can be observed in approximately 5 to 10% of the society. It can happen in both men and women. Some people see it as a serious problem because it breaks wudu. In fact, I have even seen patients coming to the outpatient clinic who make the napkin in the shape of a funnel and attach it to the penis, or roll the penis with a napkin and put a rubber band on it. Some people are very meticulous, very picky about this. But here's the thing, our urine retention system does not work after the prostate. In other words, about 10 cc of urine remains in the pipe section in the area from the tip of the penis to the prostate after urination. You can expel a little more urine here when you squeeze the muscles of the pelvic floor strongly. Here, with the relaxation of the muscles of the pelvic floor, with frequent urination or because people with overactive bladder urinate more often, more urine remains in that area. And this complaint increases in patients. Also, if this urine dripping catches the attention of the person, it becomes a serious problem. Some say that it did not happen before, but there is definitely some urine dripping in everyone. If it attracts the attention of the person, he or she becomes even more fixated on it. They can't get it out of their head as to why this is happening. Of course, there are studies on this subject. They focused on Kegel exercise, especially on pelvic floor muscle exercises. I have explained how to do Kegel exercise in detail. If you contract those muscles strongly during Kegel exercise, the urine remaining here is excreted. In some patients, we recommend a patting motion in front of the anus, from the perianal area between the anus and the ovaries to the tip of the penis. If a patting motion is made to expel the urine here, we can get some more urine out. Apart from that, tadalafil, one of the PD-5 inhibitors, was used for this complaint, but I think it is very strange. It has nothing to do with it, but they have shown that it helps. Tadalafil may be good for frequent urination complaints as it may be good for the person's complaints about the prostate. Because when we reduce the complaints about frequent urination, these complaints of the patient are automatically reduced. In other words, it may be useful if the patient has complaints such as overactive bladder. For example, the average number of urination visits per day is between 5 to 7, but if the patient urinates 10 or 15 times, of course, the patient will have more complaints of dripping after urination. We can give treatments to reduce these. For example, they can move away from spicy foods and carbonated drinks. They can reduce the sweet and salty ratios in their diet, remove diuretic blood pressure medication if they are using it, and use medications that can increase bladder capacity. This complaint may also improve when the person receives treatment for overactive bladder or prostate symptoms. Of course, patients come to us with the complaint of urinary incontinence, not urine dripping. If there is urinary incontinence, a urologist should evaluate this. Especially if the patient is over the age of 40, both prostate and overactive bladder complaints should be evaluated. Thus, the right treatment can be given. But as I said, the most effective treatments that will provide you with the best results are to pat the penis well from the front of the anus to the tip of the penis and to do exercises to strengthen the pelvic floor muscles. Thank you for listening. Best regards.